about intracranial aneurysm. I'm working with Prof. Abdul Alasta in modern European hospital. Total case, we working in modern European hospital, 79 case, 45 male, 34 female. Clipped 71 patient. One female died due to vasospasm post-op. One female died not related to clipping, but other conditions or other disease. One male has hemiparesis to grade 3 from 5 post-op. This video about dealing with aneurysm, that's temporal lobe, and that's aneurysm, middle cerebral artery. Now we see dissection around the neck of aneurysm to dissect or see about any perforators or any other vessels. Should be care. About perforators, maybe supply important structures. This under microscope, the sectors about the neck, this neck of the aneurysm, fundus in the temporal lobe, cannot put it clip if no dissection before, all perforators, and clear seeing the neck of aneurysm to put safe clip. This dissector should be trans from side to other side. If go to other side, can we clip? Can we put it clip? Middle cerebral artery aneurysm. If you traction in the temporal lobe, can rupture fundus, and maybe patient die before dissection or putting clip. In middle cerebral artery, the care for the traction of temporal lobe should be not traction temporal lobe, because the fundus in the medial temporal and we see until putting the clip. Now trial to putting the clip around the neck. After we see proper putting clip in the safe neck or in the proper neck, check the caliber of the vessels and no other perforators or other vessels around the or in the clip. This in other patient, after clipping the aneurysm, neck can aspirate by 1 cc syringe, aspirate fundus to decompression the fundus and dissect the fundus safely now. Another case, we see that's clip applicator. No? Yes. Another case. Okay. Trigeminal neuralgia compressed by aneurysm. That's aneurysm. That's facial nerve. That's trigeminal nerve. This patient can be rubbing aneurysm, separated aneurysm, meaning rubbing aneurysm and separated aneurysm, fundus by Sergicil and muscle graft. Separated them from the trigeminal nerve. In this case, that's facial nerve. That's aneurysm. That's trigeminal nerve.
Dr. Adil, you have 5 minutes. You can go faster.
This case, left ophthalmic artery aneurysm has tendency for intraoperative bleeding worldwide. Bone should be drilled around clinoid to get proximal control. Care for optic nerve need good plan, good and meticulous dissection, good hand and good mind. See this after anterior clinoidectomy around the aneurysm to prevent rupture aneurysm. This case, we see left middle cerebral artery bifurcation aneurysm, anterior communicating artery aneurysm, patient Maimuna. This CT scan pre-op. That's CT scan anterior communicating anterior for same patient. No. Anterior communicating artery aneurysm and distal anterior cerebral artery aneurysm, double clipped for this patient in this image. Can you see this one clip and this other clip? Patient good after operation. Giant right anterior cerebral artery aneurysm. Can you see? That's giant aneurysm. giant right anterior cerebral artery aneurysm. Other. Can we see this giant anterior artery aneurysm? This patient after clipping. May. After clipping. Boss, other case. Giant right anterior cerebral artery. Giant right anterior cerebral artery. Post-op. That's clip. That's rubbing. Anterior trigeminal neuralgia you see before in video. Trapping. This patient came after post-traumatic carotid cavernous aneurysm. Patient 16 days came post-traumatic, came with bleeding from the nose. Doctor ENT before exposure, the ENT specialist opened the nose, but hardly stopped bleeding, and then referred to Modern European Hospital. Cardiologist
1 minute,
also
Dr.
referred.
Adil. 1 minute.
Okay. Trapping the aneurysm from the internal carotid artery. That's internal carotid artery. Compression test. Compression test. ما تقلبش. Before and post. Trapping ligation internal carotid artery and internal carotid artery from the proximal ophthalmic artery. After we check after compression test to see the posterior communicating artery and anterior communicating artery working good. This giant aneurysm before and post. There follows can anyone you need see any patient or any case or any file of the patient or videos can came to Modern European Hospital. Welcome.
Thank you, Dr. Adil. Thank you, everyone. We are running of time. We give our thanks to all our speakers from all countries and from our country. And now I call Prof. Qasim Al-Asbahi to announce about the Yemeni Neurosurgical Society. And thank you, John Bennett, for your collaboration with us and preparation for all these speakers.